Hey everybody, it's Dr. Bart Anderson from Activate Metabolics talking with one of our all-stars, but also somebody from our leadership team who advises, one of our clinical advisors, Dr. Brandon Pettke. Dr. Pettke, say hey.
Hello, you're too kind. Thank you very much for the kind words. Appreciate it.
Dr. Pettke is down in Texas, has helped a ton of people down there, but also, you've been doing some stuff that your reach is expanding well beyond just, your city down there. Talk about some of that and the things you're doing there and some of your tools that you're using.
So we've always, I'm in the clinic's actually in Burleson, Texas, and we've, in this local area, we've helped a ton of patients, literally hundreds and hundreds of patients. We've expanded into Fort Worth area. Then we expanded into even into telemedicine, where we could do it virtually anywhere. I'd previously been doing, phone calls from different patients that referred people over from different states. Now we're able to do it through telemedicine, and now we even have an online program that is available too. So we've been able to just, expand and help more and more people over the years. So it's been pretty cool to see.
Yeah. How long have you been doing the Activate program?
Here in the clinic, we've been doing it for about 5 years now, something like that. Yeah.
So we got started right about the same time, I know, and we've both helped, lots of people. I want to highlight a little bit of something that we're, getting ready to introduce for me, for all of the Activate clinics that you are responsible for, which is the book that you wrote. Can you tell me a little bit about that? Because that's going to be awesome.
Oh yeah, so that's a book that I call it to patients, I call it the mini book. It was frankly something that I wrote just to convey more information to patients. It's called Foundational Nutrition is the title of the book. And basically I'd written it because what I got taught in my doctorate level program in terms of nutrition, frankly, turns out it wasn't practical clinically. Let's just put it that way. The things that I learned, I tried to apply in the clinic, and I just wasn't getting results. I personally had some of my own health stuff that I was dealing with, and like traditional means weren't really taking care of it. So I kind of had to go on this journey for myself. And that's really where I kind of started learning about these different things. It's like, oh, that wasn't what I was taught. And so I went down this whole journey and stuff. There was a lot of stuff that were, misconceptions about nutrition and whatnot that were the same things that, what I thought were the same things that my patients had heard and believed as well. So I basically wrote all this stuff down in this book, and I just started giving it to patients as I was working with them. And then that just kind of, turned into an actual real book now called Foundation. So
yeah, it's great. It's great stuff. And, really what you teach in your book is what has rolled into the Activate, Metabolics program. Obviously, that's why it resonated with you. And I know for me, and I want you to speak about this, when I have a tough case, I connect with you. You're great about that. And so what happens when, with tough cases, for you and your clinic, people have tried everything. What is different about, just share what we do, what's different, and how that helps people.
I would say the biggest thing of what we do differently is a lot of times for many of these patients is we're actually essentially addressing the root underlying cause. There's a lot of times that when people go on just a diet, and there's all kinds of diets out there, of course, when people go on a diet, they're renditions of a lot of the same similar thing. And a lot of the underlying metabolic dysfunction, a lot of the gut dysfunction is never addressed. Literally, like we even have patients that have had, weight loss surgery. So whether I've had the whole gamut. I've had people that have had gastric bypass, lap band surgery, the sleeve. I've had them all, and they've had difficulty, losing weight. Or actually, usually what truly happens is they will lose weight initially with the surgery, and they'll lose a lot of times a significant amount of weight, 75, 80 pounds, 100 plus pounds. And what I tend to see them in the clinic is about 1.5 to 3 years later, all this weight has come back after they had this drastic weight loss, and they're like, I've changed nothing. Like, what the heck is going on? Like, I got to get this. Because I know not only do they feel bad about, like self-image and all that type of stuff, but then of course now the health concerns come back. So what we do in the program is we address a lot of these underlying issues. And I think that's why we've had the significant success that we've had with patients using the Activate Metabolics program.
Yeah, absolutely. And I've had very similar, you know, and those are, some people may consider those the extreme cases. What do you find is the most common, you know, what's the most common client that you see and you help in your clinic? Because I'm sure it's about the same, but I'm just curious to hear you say it.
Are you talking about from like an age demographic and that
Yeah,
like
like
that
the, yes.
amount to lose?
Yeah.
Probably, I'd probably say that we see a little bit higher percentage of females, probably a 60% females, 40% males, is, if I was to guess off the top of my head. A lot of times in that 40-year range, and most of them have somewhere between 30 to 50 pounds to lose. We have some that have less, of course. We have some, as I mentioned before, that have 100 plus pounds to lose. But that's, I would say that would be kind of my average if I was to. But I mean, we've literally had people that are teenagers to in their 80s. So we've had the full gamut of everything.
And that's exactly why I asked that question, because I think sometimes people maybe see a story or see information about our programs, and they make this assumption that, well, I don't need to lose 150 pounds, so this program's not for me. Or on the flip side of that, they may say, well, that lady only needed to lose 20 pounds. I've got to lose 100 pounds, so that program must not be for me. So I think just in seeing the ages and the differences and just how it really does apply, because the principles that we teach and apply are applicable to everybody.
Yeah, so that's, you know, of course we do the genetic testing and whatnot. So human biology is human biology is human biology, right? And then we can take it and we have these little nuances genetically that then, you know, we can really dial in with a patient and really customize it to that individual patient. But like you're talking about the principles and stuff, we're all humans, right? So the principles are going to work, and then we just fine tune it, you know, based off of the individual. And I think that's another reason why we get such great success in the clinic.
Let's turn directions a little bit. Let's shift to right now with what's happening these days. And, you know, why do you think, you know, with all the principles that we, you know, that we talk about, why is right now during this whole pandemic thing, why do you think so many people are challenged and frankly gaining weight? What, you know, it seems obvious, but people just seem puzzled that, oh my gosh, what happened here? So talk to that a little bit.
So, of course, right now, everybody's world has kind of changed to one degree or another. For a lot of people, it's very stressful. So stress, one of the things that foods do is they create what's called a dopamine response. I won't try to get too technical mumbo jumbo, but a dopamine response is basically, dopamine is a hormone, is the feel-good hormone in the brain. And so they basically kind of, you know, to address some of the stress, they eat these things. And frankly, a lot of these foods are literally engineered. They're literally called food engineers to create a higher dopamine response. Well, what that does is that starts to, those foods are not usually the highest quality foods. So then what happens is you start to have this process biologically where the patients start putting on weight. Well, that just, you know, with the whole pandemic and, you know, we talk about, you know, increasing our immunity. Of course, we got to do all the protective stuff, but then internally increasing our immunity. I mean, it's very, very clear all across the country, actually all across the world, that one of the highest risk factors is obesity, specifically morbid obesity, and all these comorbidities. You probably heard that in the news when people hear those terms. But that's your blood pressure, increased, you know, cholesterol, diabetes, you know, things of that nature. Well, what's the root issue with a lot of these things? It's underlying metabolic dysfunction, which obviously is exactly what we address in the clinic. So we have had people reach out to us because they're like, all right, this is kind of like the catalyst, this pandemic of, I got to really look at what I'm doing with my body and with my health, and I got to make some changes and improve this thing.
Yeah, that's right. So I want to switch gears again, and I want to talk to you. You speak a lot of times when you use the phrases or the words, you know, differentiate for us between somebody being focused on weight loss versus focused on metabolic dysfunction. Can you, I mean, that's such a, you know, it's like cause and effect, I know, but people they're so focused on a number, so focused on weight that they really take their eye off of the ball, I think. So speak to that a little bit if you can.
Yeah, so I mean, there's a lot of gimmicky things, frankly, that people can do to lose weight. I mean, we've all seen people do it. We've all heard about them. And they'll lose the weight, And then as soon as they stop doing whatever they're doing, whether it's I'm not picking on any program, but I'm gonna use this one because it came to mind, HCG, where they're eating 500 calories a day. They're gonna, guess what happens? Oh, surprise, surprise, they gain the weight back, right?
Yeah.
And so anyway, you can do things to trick the body into dropping weight, but what you really want to do for long-term success is you want to create, as I was saying, you want to create change metabolically, so that metabolic dysfunction. I'll touch on it real briefly, but basically there's two fuels that your body can burn. It can burn glucose, which is sugar, and it can burn fat for fuel. And so where most people that are struggling to lose weight is they're the primary sugar burner. And as soon as they eat, 2 or 3 hours later, their energy goes down. They feel hungry. They want to get something else. They typically go for something else that's bad. They eat again. And this whole metabolic cycle continues, and they can't lose weight. And they do these gimmicky programs, and they never basically switch their body from burning sugar over to burning fat. So guess what never happens sustainably long term? keeping the weight off.
Weight control.
It's just this roller coaster back and forth. And as most patients say, it's not just back and forth. It's usually down and up and a few pounds, and down and up and a few more pounds. And so what we do is we really address those underlying physiological metabolic changes for the long term, so that patients can not only lose weight, significant amount of weight, but keep them off for a long time.
Weight control. Less focus on weight loss, more focus on weight control. I love it.
And I didn't really touch on this, but you asked about, is so, again, thinking in our mind's eye, it's not just about dropping down to a number. It's really about maximizing our body's health. And when we do that, everything else takes care of it. So it's not addressing the outside symptom, extra carrying the weight. It's really addressing the underlying root issues and root cause of what's going on.
Absolutely. Awesome. Well, hey, let's switch gears again and differentiate for me, because you're so good at explaining this, and for other people, so many people get hooked on or focused on, and with good intention, with good logic, counting calories in, calories out, this whole thing, and you do a good job of differentiating. Like, it's really not about that. Like, what's it about and why? Can you touch on that?
Yeah, so this is something my patients hear from me all the time. I reiterate it again that weight loss is not primarily calorie driven. I know we've all heard that, just burn more calories, eat less calories, burn more, you'll lose the weight. It doesn't work that way. It's primarily hormonally driven. All right, so weight loss is primarily hormonally driven. Do calories play a role? Yes, they play a role, but literally hormones are about 80 to 90% of the weight loss equation. Calories maybe 10 to 20% of it. And so, I can literally take a patient and I can have them eat 1,000 calories, and I can have them gain a significant amount of weight. And I can take that same exact individual and I can have them eat, 2,000 calories a day, and I can have them lose a significant amount of weight. Why is that? If the calorie model worked, then that would make no sense whatsoever. Well, that's what happens, and the reason why is because it's primarily hormonally driven. And one of the biggest influences of our hormones is what we put in our mouth in terms of food or drinks. It's a term. It's called epigenetics. We have our genetics. Think of it as your hardware. Epigenetics are these little switches on top of the genes that we can essentially turn on or off. And if we're talking about weight loss, if we want to keep the genes working properly so we can lose weight, well, depending on what we put in our body determines how those hormones affect those genes, and that determines whether we can lose weight or not. So what we can do in the program, obviously, is tap into an individual's genetics, and we can find out specifically what exactly they need to do to lose weight. So
Yeah. Now
you hope that seems enough. I got too technical mumbo jumbo. Something popped up on my screen, so I'm gonna get it away.
Yeah. No. You do such a good job of breaking technical things down into nice, nice bite-sized or digestible, morsels for people to understand. So I want to switch gears one last time, and I want you to talk about some of the cases that stand out. I mean, in your mind, obviously you've helped a many, and they're all great fans, and you don't want to minimize anybody's success, because success it's a little bit of subjectiveness, but what are the ones that just really jump out at you that just made a real impression on you?
I'd probably say there's 3. Can I cover 3? I'll do it real quickly.
Yeah.
One, we kind of touched on it before, the weight loss surgery. Her name is April. She had weight loss surgery. She, as in her own words, she was the poster child. She was telling everybody about how great it was, the weight loss and how they should do it and so forth and so on. She had a significant amount of weight to lose. And then, as I alluded to earlier, she was one of those classic patients that, a few years later, all that weight started coming back on. Yeah. And she was like, what in the world is going on? And so anyway, so again, with hers, there was some underlying issues that frankly were never addressed, that a surgery is not designed to address. And so we started, tapping into her genetics and finding out exactly what she needed. And, fast forward, she's now down 50. Actually, this was from the time that she did her little testimonial video, just kind of sharing her story and stuff. She's over 50 pounds down. I know that she's down more than that now. So that'd be one. Another one would be, it's actually a friend of mine that came in as a patient we know him from church, dealing with hypothyroidism, had some food sensitivities, she had gluten intolerance and stuff like that. She was doing paleo, and then she tried keto, and they were doing all the different things, trying to really get her weight under control, and could not get past this plateau. And so she came in, she's like, what the heck is going on? Is there a way that you can help me? So we walked her through the process. 90 days later, she was 28 pounds down. This is now probably 4 years ago, maybe 5 years ago, something like that. She is still, in fact, she's actually less than when she ended the program in our clinic. She actually texted me a few months ago and said she's actually less now than what she was when she got married 20 some odd years ago. So that was pretty awesome.
So it's sustainable.
Yeah. And then the third one I'd probably say is, one guy in particular comes to mind. I've had a number of diabetics, but type 2 diabetics do really, really well on this program. Yeah. But anyway, he was struggling to get his A1C under control. He was taking, metformin. He was taking some other medications, and he really wanted to get off of those. He had tried working with his doctor. He had lost like 20 or 30 pounds before coming to our clinic. And then he just couldn't get past it. And so it was at the beginning of the year when he started, and he's like, all right, I got to do something about this. Fast forward 6 months later, he was down 50 some odd pounds. He was off all of his diabetes medications. And at the timing of when he kind of shared his story with our patients stuff on a video, but he hadn't gotten off his cholesterol medication, but he's now completely off his cholesterol medication too. So again, he literally told me he went down to visit his son, which lives about 3 hours away, and his son was like blown away. His son's in his 30s or something like that. And he said, literally, he goes, Dad, if you I may not have recognized you if I saw you out of the store. Like I literally had to do like a double take. So it's pretty impressive to see.
Yeah. And just quickly, a couple that stand out for me is, we have one guy who's, does lots of stories for us, but his story is so remarkable. Rich Conley, he's pushing 290 pounds, lost now, came in over 500 pounds, revolutionized his life. And, he's now a fitness dude before he was basically immobile and homebound. So that one stands out. And then one that stands out for me is a female who really didn't have that much to lose, maybe 20 or 30 pounds, which, I know, again, that's relative. But the unique thing is she was a fitness instructor. It was just frustrated. Like, I feel like I'm eating right. I'm exercising. My job is to exercise and to lead others, but I can't lose weight. She locked in, did great, lost weight, and, understood the role that eating versus fitness really, really plays. And fitness is obviously important, but we also know it's a smaller piece of the pie, as we've discussed before. So, hey, if people want to see more stories about you and your patients and your success, tell us how they can do that. Because I would like my people to see your stories, and I'll do the same. So for you, how do they see more of your stories?
Yeah, so they can go, probably the easiest thing is go to our website. It's fatlossburleson.com. Again, obviously, fat loss, and then our city, Burleson.com. For those that aren't in the area, it's Burleson. I'm sure they'll put it on the screen somewhere on this video, or they can call our office directly, 817-297-7100, and they can contact us that way. We get them set up to do a consult and see how we can help them. So if any of your people want to see ours, so it's not just like a Dr. Mark's thing, then they can do that. What's yours? So if somebody that sees it, my patients or people around our area, if they want to see some extras, what's your stuff?
For sure. Yeah. Well, there'll be some on Facebook here if this is where this shows up. But also our website, the easiest way to jump to our website is Time for Fat Loss, time4fatloss.com. And that'll push them right to our site. Plenty of stories on there. And I like people to watch stories so they can relate and they can see. For us to talk about is one thing, but to put themselves in the position, for instance, the fitness instructor that I just referenced, maybe that would help hear from somebody who's in their shoes and make more sense to them. So I know you feel the same, but I don't share stories to brag about the program. I share stories so people can relate and see how it may fit into their life, because I want people to be the next success story. I want them to be their own success story.
I say the same thing when I do these, when people are willing to share their stories and stuff. I say they don't want to hear me blab. They want to hear from you, because they relate to you. On the fitness instructor, interesting, literally this couple weeks ago, maybe 4 or 5 weeks ago now, I had a fitness instructor that she's kind of, here she is supposed to be, fit and encourage. And she's like, I know I got to do something about this, and I cannot get this weight off no matter how hard I try. So yeah, we really do have the full gamut.
Yeah. Well, hey man, thanks for talking today. I look forward to jumping back on and sharing more in the future, and hopefully people watching can learn from you and be inspired to make change in their life. And we'll put some contact information up there for both of us, and people can reach out, and we look forward to helping everybody in the near future. Thanks, Dr. Pettke.
Thank you. I appreciate it very much. Have a good one.
You got it. Okay, bye-bye.